Good afternoon, Miami Gardens. Welcome to another episode of Live Healthy Miami Gardens Live. I am your host, Melissa Network, and a member of the Live Healthy Miami Gardens Communications Subcouncil. As you know, I come on once a month to have a conversation in regards to community health in general, but COVID-19 and the flu specifically. So today we are exploring this concept of home remedies. Home remedies in COVID-19. We're going to get a pharmacist perspective in today's conversation. We're going to be speaking with Dr. Gina Jules. She is the CEO and founder of Anuco Pharmacy or Anuco Rx. She is really dedicated to serving diverse communities. In fact, she has been doing it for over 15 years. Now, Dr. Jules graduated from FAMU with her doctorate in pharmacy, and she completed a managed care residency. So her perspective, I think, is quite broad. She's seen it from a clinical perspective as a pharmacist, as well as from a managed care perspective, and course, looking through the lens of a Haitian American woman. Ladies and gentlemen, put your hands together for this conversation that we're about to have with Dr. Jules. Good morning or good afternoon, Doc.
Good afternoon.
Welcome to Live Healthy Miami Gardens Live.
Hey. Thank you, Melissa.
Yeah, so this is a time really where we kind of chat about different issues around COVID and the flu that impact diverse communities like the city of Miami Gardens. So before we start, though, could you just share with us a little bit about your background?
Of course. First, thank you for having me and welcome the city of Miami and all of the viewers out there. Just a little about myself. My name is Dr. Gina Jules. I am a clinical pharmacist and founder, CEO of Anuco Rx. I grew up in Broward County and built my business right here in our own backyard in Broward County. I've been a pharmacist for over 15 years now and have been very passionate about the diverse community. I am of Haitian background, and I've been an advocate for those individuals where a language barrier has always been a challenge when it came to healthcare needs. And so just really excited. I think Melissa and we were having a conversation just in reference to COVID and all of our remedies, our home remedies. And so just looking forward to sharing some of our thoughts with you guys. Thank you.
Yeah. So listen, it's so funny. I can't even believe that we're 2 years into the pandemic. It's like 2 years already, right?
It's going on 2 years, yeah.
It's going on 2 years. So I remember when, and it's one of those moments when you kind of, everybody perhaps remember where you were when the world stopped because of COVID, right? And I remember like when this whole idea came out, while we were waiting on pins and needles to find out about a vaccine and how does it transmit and how does it not transmit, I remember getting phone calls like from my relatives in Jamaica, and my ex-husband is Haitian. And so also from my Haitian side of my family about, what teas I should be drinking, So I drank, no lie, I drank leek tea with garlic and ginger and was it cumin?
Cumin, yeah.
Cumin. And then I also drank like a whole bunch of moringa, like anything to keep my immune system healthy. And so I understand when people say that they took a lot of home remedies, but what I don't get is only doing the home remedies and not also getting the vaccine. Like, can you speak a little bit, like, how is that for you as a pharmacist?
That's a valid point, and I can assure you that I've been drinking some of the same tea that you've been drinking and continue to drink those types of herbal remedies that our parents, grandparents, aunts, and uncles have provided to us. And the thing is, at the beginning of COVID, I mean, I had family and friends from various cultures. So I was getting tea from my Haitian family and friends, from my Jamaican friends, and also my Nigerian friends. And so it was ways of trying to build our immune system and trying to ensure that there is, that we stay healthy, and that we were unsure what COVID is, and we didn't know how long it was going to last. We didn't know how it was going to turn, how it was going to pan out. And so, I think as a culture, even back home, we always go back to our roots, which is, we know that this leaf does that and that leaf does that. And we're dependent on our elders, right? My aunt, I mean, I call her like a guru. You can point out a piece of grass and she'll tell you exactly what piece of grass that is and what you're supposed to blend with it. And I'm like, I always tell her, I was like, you need to like craft something, a book of some kind, because that's our comfort. That's what we know. That's what we turn into. And we have to understand that in our country, right? Modern medicine was not the first thing that we turned to. However, I think as we evolve as a society, we begin to educate ourselves and lean more so, not just on the herbal side, but also on what modern medicine has presented. So I think that, it's a good perspective to kind of go back to home, to the roots for certain things, but also to educate ourselves on what's out there and how we can support our immune system, and to be great educators to our community, and just, ensure that we're all helping each other.
Do you think that there's room for both?
Yes, I do. I do think, and as a pharmacist speaking, I mean, I got vaccinated, and I continue to have my ginger and my turmeric. I believe in health and well-being as a whole, right? And we have to listen to our bodies. And so it's not just when you're feeling sick, but we should think about wellness and healthy being, just healthy aging, actually, just throughout our life. And so how do we become advocates and trying to educate ourselves? And I can understand the hesitation when it comes to modern medicine, because our community, have been impacted significantly. And there's a sense of distrust with modern medicine and all that comes with it. So I think that we have to find trusted resources. We have to engage in what we are comfortable with. And I think as healthcare professionals, we shouldn't just push people aside because they're stating like, hey, well, I'm just drinking ginger and honey and turmeric or bitter leaf. But we should understand and have empathy for that culture, but yet embrace what we see today with the modern medicine.
Yeah, and I think that, Dr. Jules, that's where the challenge lies for both the patient and for the clinical provider. So on the patient side, it's going into the conversation with an open and willing heart, right? So that you perhaps maybe there's a little hint of mistrust, but you at least can trust the medicine. You know what I mean? And you're willing to try. You're willing to have that open dialogue. You're willing to ask questions to make sure that you choose the provider that works well for you, right? And then on the provider side, I think it's understanding these cultural nuances that we talk about. Just because you drink soursop leaf and bitter leaf and you know how to get a little bit of sorry, it doesn't make you crazy or less valid.
Correct. And I think that we see a lot of things too from our traditional, our herbal side, right? When you talk about soursop, right? I mean, growing up, I remember during the summer, my uncle had a soursop tree. And I mean, we used to drink it like it was lemonade. It was tasteful. And there was so many health benefits to it that we didn't even realize. And so now think about it, you can't even find a soursop tree. you find that they're finding the leaves and grinding powder. And now, Western medicine has now incorporated the benefits of soursop leaves. But, think about it, our family, our parents, our ancestors have been
drinking soursop for generations.
For
Absolutely.
generations, yes. I mean,
Absolutely.
I went to the store, soursop was like $20-some a pound.
Yeah.
It's crazy.
And incidentally, my dad has a tree, so
right. You're talking
I have the hookup in Broward County.
Okay, so we're gonna hook you up because my dad just started growing his, which took about probably 5 years. It just started. You're starting to see something.
Okay.
So I mean, there's that. I think that we just have to be empathetic, and we have to empathize with whoever is in front of us, on a patient perspective and also on a healthcare provider perspective. And I mean, I find comfort sometimes when I talk to my Haitian patients, and I'm like, Mommy, I know you are doing this. And, they're like, well, and so as they become very comfortable with you and they understand they're not being judged, and they feel that level of comfort and intimidation plays a huge role in our culture.
Oh my gosh, that's so on point. Because I mean, think about it, even with me, right? So I'm type 2 diabetic. And so I have a really great endocrinologist that's new to me. And I remember when we sat down and we started going through the list of my, when you do that intake and you get the whole list, the history. And I was telling her all of the medications that my previous doctor had me on. And then she's like, what else are you taking? And I said, oh, that's it. And she's like, are you drinking any teas? Are you doing any herbal medicine? Are you taking any supplement? Had she not asked and used that term to give me a level of comfort, like, okay, I could talk to her. But then thinking about it too, like she's Puerto Rican. So I think she gets it, right? And because she used that language and she asked the question the way that she asked the question, I was comfortable telling her, I do turmeric and garlic and I drink my leek and so I think that you're absolutely right. There has to be that level of conversation and trust with the provider in order for the patient to feel the empathy and to feel comfortable enough to disclose everything. Because otherwise, y'all could be judgmental.
You're absolutely right. And we have to recognize too that some communities, they face multiple communication barriers. For example, there's limited health literacy and limited English proficiency that frequently they coexist. So therefore, interventions for these vulnerable population is key. So there has to be a two-way interactive communication. Like you stated, she went back and said, okay, these are your list of meds. Okay, what else are you taking? And it's like, oh, you had that aha moment in a sense of, well, I also do my soursop or my bitter leaf or my iscan. That's how we call it. But it all depends on that form of communication. But at the end of the day, our goal as healthcare professionals is to ensure that the individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions for themselves and for their families.
Well, let's talk about that a little bit. Let's touch on health literacy. You mentioned before that giving people information about their health in a way that they can understand is an important part of the process, right? What would you say to providers to encourage them to be more inclusive with their information sharing?
I think that's great. That's a great point. I think the most important piece is to be an active listener. And active listening, it just really gauges to a point of, I know I'm here, but are you listening to what I'm saying and repeating what the person stated in a form, in a way that's simple and just plain language, right? So active listening is key, and also empathy. having empathy, having both empathy, it goes both ways. But those are ways that we could to help engage our patients and to engage our providers.
Yeah. So if you're joining us now, we are having a really interactive conversation. I ask you to go ahead and type your questions in the chat. I see some folks. Sharitha is saying, good question. Thank you, Sharitha. If you have any questions, you want to join the conversation. Right now, I am speaking with Dr. Gina Jules. She is a clinical pharmacist who studied at FAMU and did her clinical residency in managed care. She actually is an expert, not only a pharmacist in managed care, but also she has a knowledge base around health literacy and the cultural competency way of practicing medicine. So if you have a question, you want to join the conversation, do drop your question in the chat. And, be my third co-host here. So, you keep using the word empathy. Can you speak to that? Why is empathy so important?
I think that being empathetic requires us to understand someone's feelings and perspectives. So the first step in showing empathy is to find out why, right? So for example, you could say, why do you feel that way? Or why is that what you believe? Then take the conversation from there. So now that we have to understand intercultural empathy, we have to understand empathy. Intercultural empathy is placing yourself into the cultural background of your patient or that individual and being able to effectively communicate that person's understanding of of the world, of that person's world. So when we look at it, we have to take it to that step in a sense that understanding why does someone feel that way and not just brush them off just because if they feel like, hey, every day I have to boil cloves and garlic and this is what, this is what this is what I've been doing and this is what works for me. But understand why are they doing it that way and why do they believe that they should do it that way.
So those are really good tips, I think, for a provider to kind of open that line of communication. But what do you say to a patient, right, who may be struggling with a little bit of medical mistrust? Like, how do they have that kind of conversation with their doctor where they feel comfortable enough, open enough to disclose what home remedies they're taking?
That's a really good question, Melissa. I think it comes to bridging that rapport between that patient and the doctor. I think that you are your biggest advocate when it comes to your health and your well-being. And for those of you who are taking care of mom and dad and grandma as caregivers, right? And so how do we tell our healthcare providers this is what we are doing, this is how we're taking our meds or we're not taking our meds, is that you just have to find trust in whomever that you are going to. So if you can't trust your healthcare provider to disclose freely, then that means you need to find someone else. You need to look into another provider because you want to have that level of comfort. And just realize that what you're saying to your healthcare provider is to help you at the end of the day. And again, I'm speaking as a healthcare provider, but also I can speak as a patient because when I speak to my providers, there are some things I'm reluctant to share, right? Because it's human nature. So we're not perfect ourselves. So on the flip side, I have to ensure that there is a level of trust that I have with my healthcare provider and ensure that there's an open line of communication between all parties involved.
Listen, I'm going to tell you this. What you said a while ago, that if you can't talk to them, find somebody else, that is the truth.
Yeah.
That is the truth. If you don't feel a level of comfort where you can actually sit down and speak to the doctor, in a language that you feel comfortable communicating in, in a way that you feel comfortable communicating. If you don't have that space and you feel like they're rushing you, or
Yes.
get another doctor. And then here's the thing. I think a lot of patients who may not have like the best insurance kind of sometimes feel like you take what you get. But I disagree with that philosophy. I think even if you're going to a quote unquote free clinic, you have the right to quality care regardless.
Correct. I agree with you. And, I had this conversation with my sister the other day, and I was like, well, you know what? I don't like this doctor, even though I've been going to her for years. I just felt, I just feel like she's not as detailed. I feel rushed and so forth. And guess what? I am an advocate for myself. And so I switched providers. And that is one thing I think also when we talk about our culture, that we're afraid to make changes. We feel that whatever we're getting is what we need to take. We need to accept it. And it's not, even if it is the free clinic, you have a say in your health and your well-being. You have a say for your mom, your dad, your auntie, your uncle. You have a say. And the best thing to have is a healthcare advocate. So if you can't be that healthcare advocate for yourself, then trust someone who will. If the language issue is a problem, and I know the insurance piece could be a little complicated, find someone who shares that same language, the same culture, same background, but at the end of the day, that common denominator, which is your health, your well-being, healthy aging, find that person to go ahead and be your advocate.
Wow, that's such a powerful statement. I actually feel like we should type that into the caption and put it up, Natasha. Be your own health advocate.
Be your own
I
health
think that
advocate.
is so powerful, because at the end of the day, you live in your body.
Yeah.
You live in your mind. You know exactly how you're feeling physically, emotionally, spiritually, and you're the only one that can communicate for yourself. So I think that's a really like powerful advice. I mean, I heard you give two like really powerful, I mean, you said a lot of powerful things, but in particular, the advice for providers is be empathetic,
Be
and
empathetic.
the advice for patients is be your own
Be
advocate.
your own advocate. I
Yeah.
agree.
So here's a question from Lynn. She wants to know, what could I share with the doctor if she's feeling rushed in her visits, that is intimidated when the doctor wants to rush out and she forgets everything. What can she say to bring it back to her?
Lynn, that's a great question. I think that before you even go to your appointment, write down what your questions are and what your feelings are, whatever that case may be. And when you're in there, you go ahead and you jot them and say, hey, doc, I have a few things I need to share. There are a few things that's going on and I want to sit and I want to go through it. And I think when you jot down those feelings, because I too have experienced that, where, like you go in and you know exactly what's going on and what you're going to say, then they come in, they start asking you all these questions and you're like answering their questions and then you forget what you want to say. So I think that the first thing is to jot down what you want to ask and then communicate that at the beginning of the visit. I have some items I want to share with you, and then go from there.
Very good question. Very good question. Yeah, I wonder sometimes about not just this whole medical mistrust and creating space for empathetic, meaningful conversations with physicians. And I wonder, and I'm going to ask you this question because I know you did your residency in managed care, but I wonder how much managed care had to do with creating that environment where patients feel rushed.
That is a very good question. It's at the end of the day, providers are human too, right? And so they are seeing a number of patients on a day-to-day basis, which doesn't make it right that, every patient is different, right? And every situation is different. And sometimes we think that because our providers, they see patients it's like a revolving door, that they become desensitized, right? But at the end of the day, we're all human. So we have to humanize every opportunity that we encounter. And so there's so many different things that can lead to the volume, that can lead to the outcome of why providers are doing what they're doing. I'm not targeting one particular area, but there's so many different things that come into it. I mean, and we're in a shortage, right? We don't have enough healthcare providers to accommodate society. So there's so many different factors that we have to look into. But it just goes back to what I stated before: is be your own advocate. And if you're telling your doctor, like, look, I'm trying to have a conversation with you, and I feel like I'm being rushed, guess what? You have the right to say that, and they have the right to listen.
Absolutely.
We all took an oath, whether you're a nurse, a medical doctor, a pharmacist, whatever that is. We took an oath, and our oath goes beyond whatever quotas or whatever corporate is throwing down our throats.
Yep. And quite frankly, nowadays, choosing a doctor is not as one stop fit all as it was back in the past, because now with the advent of social media and all of these different ways that we can provide feedback publicly about our providers, I think a lot of doctors are more inclined to listen now than ever before.
I agree. And again, we're all human. So we all have to humanize the situation. That same doctor is a patient of another doctor.
Yes, that's a good point. That's such a powerful point. A dear doctor is a patient of another doctor. So to kind of bring it home now, we've touched on a lot of different subjects.
I know, we're like all over.
But you know what? It's all connected, right? Because medical trust is a piece of it. I want to circle back to the home remedy, right? So as I shared at the top of the show, I took home remedies, my leaves, my things. In fact, I need to go boil some tea tonight. But then I also took the vaccine. Now, at Live Healthy Miami Gardens, we did a research study, a very small study, and we found that some of the individuals who are still vaccine hesitant in our community, part of what made them feel hesitant to take the vaccine is that they believe, some of them, that the home remedies is doing the job and they don't need to take the vaccine. What are your thoughts about that from a pharmacist perspective?
From a pharmacist perspective, I think that it's misleading when someone feel like, especially with the with coronavirus. I mean, it's just ongoing. We're getting new data. But I can just share my personal experience where, we lost a very close family member who was, just solely dependent on herbals. And they were doing all types of teas, getting it from different sources. And, it's to a point where their health started to decline and it became too late, and so I just don't want that for our community. We have to be in a position where we can go to trusted messengers and trusted sources to educate ourselves. It's key. I mean, you could tell someone, I at the beginning when the vaccine came out, again, we were trying to educate and we continue to educate individuals just to be knowledgeable on what it is you're getting. And it's okay to ask questions. It's okay to ask as many questions. And you can repeat your questions as many times as you possibly can so that you're comfortable with it. And so I think that just solely depending on herbal remedies, it's just my opinion, is not ideal. So again, I'm not judging someone who solely depends on that, because that's where that intercultural empathy comes into play. But it's the question of asking, why do you feel that you should only use herbal medications? Why do you feel the vaccine is not something that's viable for you? So that's where that comes into place, as opposed to just just judging that person automatically.
Yeah, that's such a valid point. Dr. Julius, you gave us a lot to think about, Dr. Jules. Thank you so much for joining us for this conversation today. And you know what? Any final words of wisdom?
Well, thank you. And Miami Gardens, just be your own advocate and empower healthy aging. Thank you.
I love that. Thank you guys for joining us for another Live Healthy Miami Gardens conversation. Remember, if you want to find out about resources to not only get your COVID vaccine, but your flu shot and other healthcare needs, please go to livehealthymiamigardens.com. That's livehealthymiamigardens.com for a list of local providers and resources here to help you live a happy, healthy life. All right, Miami Gardens, remember, be kind and loving to yourself today. You deserve it.